Welcome to another episode of Progress, Potential, and Possibilities, discussions with fascinating people designing a better tomorrow for all of us. I'm your host, Ira Pastor.
Welcome, everybody, again to another episode of our show. Bring you another really great guest today involved in creating a better tomorrow for all of us. Today, we have the honor of being joined by Dr. Alex Colville, who is the co-founder and general partner of age1, which is a new venture capital firm focused on catalyzing the next generation of founder-led longevity biotech companies, ultimately with this strategy of building a community of visionaries that help advance these new therapeutics, tools, and technologies to ultimately target aging and age-related diseases. With their recent initial closing of $35 million, the fund will be focusing on founders and companies at earlier stages of first money in, pre-seed and seed funding, and there's also a resource to help to continue to support those companies through the later rounds. Dr. Colville previously established the biotech arm of Starbloom Capital, served as a founding chief of staff of Amaranth Foundation, where he was leading that foundation's support of researchers and moonshot projects in the longevity field, also helped to advance their lobbying efforts, has been involved with the Time Initiative, which is a really interesting group with a mission to activate sort of the next generation of undergraduate students and their interests in aging biology, spent time developing the Marine Biology Laboratory Biology of Aging summer course, among various other programs. Dr. Colville completed his Ph.D. in genetics at Stanford, studying the biology of aging in Tom Rando's lab, while consulting at the time for several family offices, also worked with the R&D team of Rubedo Life Sciences, the business development team of Maze Therapeutics, and prior to his PhD, he was at Northeastern University doing his Bachelor of Science in Chemical Engineering up there, also minoring in Biochemical Engineering and advising various pharma companies as a management consultant at Putnam Associates, a boutique life sciences consulting firm. A lot of really interesting and new topics to get into today that we don't usually touch on. We're excited to have him. Dr. Alex Colville, thank you so much for taking the time to come on the show.
Thanks so much for having me. I can't wait.
I'm very much looking forward to getting into a lot of interesting themes today, Alex. As we typically do, I'd love to start things off with you because I enjoyed reading through sort of your publication history and prior to all this aging stuff, you were while you were at Northeastern, you were studying all sorts of interesting surfactant systems and other interesting topics. I'd love for you to hear the early story about sort of when you got bit by the aging bug and, obviously studying the mean field coarse grain model for polyethylene oxide, propylene oxide, ethylene oxide, tri-block copolymer systems is exciting, but aging is even more exciting. So tell us a little bit about the early days.
Yeah, definitely. I think I was actually bit by the aging bug much earlier than that, believe it or not. I want to say when I was very young, very, very young, probably like 8 years old, is when I became enamored by the idea that this field might be possible. And then I kind of lived in ignorance for probably, must have been like 10, 12, 13 years, after that, before I even found out that the field actually existed. So there was this period of like over a decade of my life that I thought it would be really cool to work on this problem of like intervening in aging and changing the way that humans age. But I had no idea that people were actually working on it. And I know that seems so silly today with how much the field has grown and how kind of apparent it is to most people that this field exists. But at the time, I just had no clue. Kind of the only things that I had learned about were the field of cancer and cancer research and people working to intervene on cancer, which I found extremely inspiring. And kind of a bunch of people along the way told me that engineering was a great way to learn how to solve problems. And I was like, oh, wow, well, like the aging field is probably going to have a lot of problems that are going to require new tools and kind of techniques to solve things. And so engineering seemed like a smart thing to do. And that was really how I ended up kind of working in chemical engineering, read about a guy named Bob Langer at MIT, who happens to be the most cited engineer of all time, and
Yep.
was really, really inspired by his story of, in essence, taking this field of chemical engineering, of which historically, back in his day, everybody went and worked for petroleum companies and kind of petroleum engineering. And he was really this pioneer to say, like, oh, let's bring this problem solving skill set from the chemical engineering world to biology. Let's figure out drug delivery. Let's see how we can, create new mixes of polymers in ways that can allow us to target drugs to areas of the body that we've never been able to target before. And that is how I ended up doing the polymer research, of which I'm impressed that you found.
No, I really, again, I did enjoy very much sort of going through your Google Scholar and looking at sort of the diversity of what you got involved with. And again, when you made that step from the biochemical engineering into aging research, you got into everything. You published on nuclear programming, reprogramming. You published on the area of the stem cell niche and homeostasis. And we talked a little bit about that with Marco on a recent episode. Some resveratrol work as well. You got to your PhD entitled Dissecting Cell Death, Cellular Senescence, and Aging with Genetic Screens. And here you do some extremely important work because you're not just sort of developing these new CRISPR-based systems to understand what's going on at the cellular level, but really sort of this aging 2.0 concept that yes, we study senescence, yes, we study cellular reprogramming, but whether we're talking about a cancer cell, a neuron, a cardiomyocyte, whatever the case may be, they're very different. And we really have to have sort of this next level of understanding what's going on there. Talk a little bit about your dissertation, focusing sort of this deeper understanding of what was happening in sort of the cellular senescence, cell death routines of these various types of cells in the genetic screens.
Yeah, so funny enough, like I got started on that project. This is like the real unfiltered, honest answers, as opposed to what you may assume just like reading papers. I got started on that problem because I really wanted to study epigenetic reprogramming more mechanistically. And I was like, oh, there's this new fad of I as you mentioned, and as you just recently had on this show, Marco Corda from Rubedo, I got to work with him on a collaboration with Vittorio Sebastiano at Stanford on kind of this nuclear reprogramming, transient reprogramming to ameliorate some facets of cellular aging. And I got kind of obsessed and enamored with the possibility of, maybe there is this way to more broadly turn back the clock on cell biology or tissue biology using reprogramming. And kind of, the evidence in that area is still super, super tenuous and early days. And we really don't know how that field is going to play out, although it's gotten a lot more translational attention of recent, which has been great. But we can return to that later. But, for me, it was like the fact that it's crazy potential, yet it was kind of like a black box at the time, and that there were only really hand-wavy explanations as to how it might be working. And for me, I thought that genetic screening was just such an obvious next step for that technology of finding out maybe even better ways to rejuvenate a cell or disentangling the mechanisms of how reprogramming was happening. Right. And so for me, I was like, okay, like that's what I'm going to do for my PhD. And what do I need to do that? Like, what things do I need to know how to do that? Oh, I need to know how to do genetic screening. So either like an shRNA screen, it's called, or a CRISPR screen. In essence, these tools that enable really high throughput perturbations of individual genes in the genome to see what can have an effect on your output. And I was like, all right, well, I have no idea how to do that. And I started down the road of thinking about how to do that for reprogramming. And I realized very quickly that uh, just the tool sets weren't really available to study aging in high throughput at a cellular level to be able to even do that screen at the time. Now we have, much higher throughput single cell RNA-seq and kind of these other readouts of cell age that people are doing these screens. But at the time that didn't exist. So I was like, okay, I'm going to take 6 months. I'm going to apply CRISPR screening to a much more solvable problem. And I'm going to do this like 6 month experiment just so I learn how to do the assay, publish on that. And then I'll go back to this core problem that I'm like really, really passionate about. And that, 6 month project turned into about a 3 year project when I realized, in essence, how challenging some of these screens are, even with easier outputs. And so this project that you're alluding to, this easy 6 month project that I thought I was getting myself into was, in essence, at the time, there was this very strong dogma of we have senescent cells as a driver of aging. They are this damaged cell type that experiences this kind of permanent cell cycle arrest and spits out all these negative immune factors that kind of drive aging pathology. This was kind of the dogma at the time. And it was supposedly a very clean story of eliminate these cells and you age better. And so for me, I was like, a perfect problem for a genetic screen. In essence, look for a way to kill cells, look for a way to kill cells that we don't want, that are undesirable. And then we'll have new drug targets, can immediately spin out a company or license the IP to somebody working on this. And that 6 month project, as it usually does in academia, turns to a much, much longer project as you realize just how much nuance there is in every specific field. And so in the case of the senescence field and what I was working on, the first problem I encountered was just that it is very difficult to, in essence, conduct a genetic screening on a cell type that does not divide. So a post-mitotic or non-dividing cell type, it's pretty much every screen that has been done to date has been done in, or at least 99% of them have been done using cancer cell lines. Because they divide so frequently, you can really enrich these signals that you're kind of looking for out of these experiments. And yet, in the case of a non-dividing cell like a senescent cell, they just don't divide, and so you don't get this crazy enrichment of a phenotype that you're looking for, like cell death. And so for me, that was kind of the first core problem that ended up being the focus of this 3 year project, which was how could I figure out a way to study cell death in a cell type that doesn't divide. And I think even beyond that, what I realized is that nobody had a genetic screening mechanism or method, excuse me, that was able to study the phenomenon of cell death. Mm-hmm. Every genetic screen, CRISPR screen, shRNA screen that was being done was lasting the course of a week to 2 weeks to 3 weeks to 4 weeks, whereas some forms of cell death can happen on the timescale of minutes to hours. And so the assay, in terms of the time it took to perform an assay, just did not align with, a biological phenomenon itself. So that ended up being, in essence, what I worked on for those 3 years was how could we develop a new method to study this biological phenomenon that is happening on a much shorter time scale than previous methods had allowed, and also, developed a method that enabled us to be able to study how to kill cells or the mechanism behind killing cells of cell types that don't divide. And so that ended up being kind of the core of that 3 year project, which I think was very, very rewarding. And kind of as you alluded to, like another part of the nuance that you realize is just every cell type responds so differently to interventions and has such unique mechanisms. And I think that was one of the beautiful things that came out of the project is, longer term, that method will be able to do more of a large scale screening across many, many different types of cells and all the nuances that they may have in a senescent state or in, various other potential biological states.
Excellent, really excellent work. And yeah, and aside from being, obviously a major step forward in that aspect of the work, it again provides you with a really interesting set of insight as you do much more now due diligence on what you're going to be seeing with the new fund and the companies and labs and so forth. So no, that's perfect. I'm glad you outlined all that for us. Before we get to age one, we can't talk about it until we talk about the sort of a precursor organization known as the Longevity Fund that was founded back in 2011 by Laura Deming, who is your partner in the new fund. You talked a little bit about this on the recent Translating Aging episode, and from that fund, we've had again, Marco, I had Adam Friend on a couple of years ago when he was with Calico Life Sciences as a PI. Talk a little bit, because obviously as you're doing all your work in the lab and sort of becoming an expert in all things aging, you also are getting your feet wet along the way in sort of the venture investing side of things. Take us through a little bit of that decade as well from the investment perspective now, and sort of what got you interested in, obviously doing a tremendous amount of awesome work in the lab. What got you interested in those early days per the development of the first longevity fund in saying, hey, I could probably do pretty good in this, not just in my own work, but in shuttling these other opportunities along?
Yeah, it kind of started back, as soon as I got started in working with David Sinclair in undergrad, which was kind of realizing that, to really make the aging field accelerate, I'm probably going to have to understand the industry side of the problem as well, not just the basic science problem. Because ultimately, what do I want? I want these therapies translated to humans to have us all kind of in this future best case scenario that I can imagine, which is everybody kind of having agency over how long they live in good health. And so for me, it was like, okay, how the heck do we get there? Seems like industry is going to play a big part. And so, in essence, need to learn a lot more about what that looks like. What are the nuances of biotech? What are the nuances of startups in the biotech ecosystem? And actually, so the business side really got started back when as you mentioned, I worked in management consulting for big pharma companies back in undergrad, and then also for the year after undergrad. That was really where I kind of cut my teeth learning about clinical trials and reimbursement and commercialization and all these other nuances of this insanely messed up system, chaotic and messed up system that we have inherited here.
Oh, yeah.
In terms of the current US healthcare system. But there's so many nuances to learn about how it operates, and unfortunately they're very key to know. So that was kind of the original how I dipped into the industry side of things. And actually at the time I was really waffling of do I go get an MBA? Because that's what most management consultants do. They get their MBA, then they in essence go either back to consulting or go do whatever they want to do in the world. And for me, that was build an aging company. And so I was sitting there at the time, do I go get an MBA and then start a company working on aging? Or in essence, what's the best path forward? And I actually cold reached out to Calico. Funny that you had mentioned Adam when you had interviewed him back in his Calico days, and I messaged in particular the business development group, and I sent an email that was, pretty typical young person email of, hey, please let me come work for you. I'll do anything. I won't take a salary. I'll come work for free. Whatever you need done, I'll do. And to their credit, they sent me a very, very nice email back immediately that in essence encouraged me, but was the conclusion in essence was, go get a PhD and we'll talk. And so, at the time, this was 2015, I think, that I emailed them. There weren't many options in terms of biotechs that you could work at in the aging field. Calico was really, one of the pioneers of kind of the second wave of biotechs working on aging at the time. Even the longevity fund portfolio back in 2015 was very, very small. Laura was just getting started investing in companies in the space. And so I followed Calico's advice. I was like, okay, well, I love the science. I love all these professors in the aging space. Let's take the advice. Let's go get a PhD studying the biology of aging. But kind of while doing that, because I always had this kind of focus on the translational aspect, kept a lot of hands and feet still kind of in that space. So as you mentioned, had the great pleasure of helping out Marco a tiny bit with Rubedo and kind of the R&D platform, the research platform that they've got cooking, a really, really cool research platform that was able to help inform, given some of my senescence work of my PhD. Was able to kind of spend the year with Maze Therapeutics, working with their business development group on some fundraising, some competitive intelligence, different various projects like that. But really kind of the investing, as you asked about like where did the investing come in? And that really started just through meeting various family offices through
Mm-hmm.
Laura's community events at the Longevity Fund. Laura really served as my mentor from just about like 2016 or 2017 onwards. Had read about her all online and was like, this person is one of the most unique individuals I've ever heard about in the universe. And so it was a very easy choice to try to, in essence, learn as much from her as I could. And that's in essence how the more investing side of my career started.
Excellent. Excellent. So perfect. So now we've combined a research background, this experience in early stage investing. We get to age 1, and really two really interesting components of the thesis, which I'd like to get into individually. One, sort of the general sort of geoscience approach to the fund, and then this the topic of founder led. And if we could really start with the sort of the geoscience aging component. It was interesting, a couple of months ago, you probably, read it in Nature Biotechnology, the Longevity Biotechnology Association, published this paper called Defining a Longevity Biotechnology Company, sort of outlining this, what I'll refer to as a sequential geoscience model. Got to be interested in health span targets, disease, and then health span clinicals at some point in the future. Some people got upset with that paper in the sense that, it left out a lot of folks, whether you're age tech or supplements or cosmetics or all sorts of other things that are happening in the aging space, kind of defined it most specifically to geoscience drug development. Talk a little bit about age 1 and specifically what sort of the core portfolio interests are today.
Yeah, really relevant points around how do you define a longevity company. I just came back from last week at the Longevity Investors Conference in Switzerland, and I think that was like a core theme that people realized at the conference. It's just there's so many different buckets wrapped inside of this kind of longevity label of what people consider a longevity company, whether that's direct consumer supplements or this kind of age tech, aging in place. There's just so many different aspects versus, as you alluded to in this Nature Biotechnology paper, longevity biotech companies and kind of what that entails. And so our focus is by and large, aligned with that kind of more longevity biotech view of the world. Mm-hmm. We really kind of view our portfolio as being 90% plus therapeutics companies or biotechnology companies. And all these companies have their place in the ecosystem. It's just, I think definitionally people get pretty confused as to like what constitutes longevity versus not. And I think that's maybe where the distinction like longevity biotechnology is more useful in terms of like defining yourself as being focused on the biotechnology subset of longevity companies, which certainly is our focus. So yeah, we are most interested in not supplement plays or kind of these direct consumer plays, but much more like, kind of a binary, like, do we feel internally that this company, what it's working on, would have the ability to make a very dramatic kind of impact and increase on human healthy lifespan at the end of the day. So not just in essence making sure that we're living all of the years that we have in the best health we can, but also really kind of extending the amount of healthy years that we have. And I think to do that, biotechnology is kind of one of the biggest levers that we have.
Mm-hmm. And as the second part now of that thesis, the founder-led component, and this is something that we've heard a lot about in recent years, but when you go back in sort of the biotech history, you do have cases like Genentech and Vertex and some other folks out there where the founders did hang out and run the company for a while, after they exploded on the scene. I think a founder-led as an alternative to sort of the traditional, thank you very much, founder. You've done a great job with this tech, and now we're going to go get the senior vice president from Pfizer, GSK, whatever, to take things from this point. Walk us through the founder-led concept, if you would.
Yeah, so the founder-led concept, as you alluded to very astutely, is something that really has gained inspiration and kind of this resurgence of energy because it worked so well historically. So we have a lot of really cool examples like Bob Swanson, the founder of Genentech, or one of the co-founders of Genentech, founded Genentech when he was 29 years old. And yes, he was a venture capitalist, but it certainly was not a venture capital creation or kind of venture creation by any means of definitions that you'll see today. So there's kind of this really rich history of a lot of like the biggest companies that we love and respect in the space being formed by these very unconventional, contrarian looking founders that then made it, in essence, their, a decade or two of their life's work to build these into these massive unicorns that have had so much, delivered so much value to humanity in the form of novel therapies and interventions, which has been so cool to see. And then kind of in that gap between, let's say, 80s and 90s and today, that kind of willingness to bet on very unconventional looking or contrarian looking founders in the biotech space receded a bit. And instead, there was a kind of a leaning into a model of investing in biotech CEOs who had already, in essence, proven themselves, had shown that they were able to build a biotech company, and then were, in essence, going back to the well to do it again. There was, in essence, a huge focus on betting on founders who had already shown that they could do something before, which totally makes sense. I think it's a great thing that those founders are being supported to go back and in essence, try to tackle a different problem in the biotech space. That's absolutely a fantastic thing. But I think a part of the problem with that model is that at the time, it became the only type of founder that was being funded in the space because markets were a bit tighter, and all of a sudden the strategy became to kind of only be willing to bet on somebody who had that experience to in essence build a biotech company. And I think, especially in the case of the Genentech founders, they really attributed this kind of naivete and raw energy to be so vital to their success. And so for us, it's something that we're really excited to bring back to the kind of the biotech industry, and in particular in our focus area of longevity biotech. Where I think, especially, there are a lot of parallels between what Genentech was doing and what the longevity field needs today, in that it's a very nascent field. It's so new, in fact, in terms of the amount of evidence that one of kind of the superpowers of working in the aging field is it's not like the cancer field or the cardiovascular disease field where, having decades of experience working on the science gives you a huge leg up, because there's just so much known about it and so much known and published in literature. The aging field is really new, and when you have these kind of much newer fields that are fast moving, you can be a founder with a lot less experience in this area and be able to rise to the top very, very quickly, because it doesn't take that long of diving into the space to become the expert, just given how, so little has been done. We still don't have, for example, a single approved drug in this space that is an aging intervention, or at least was developed to be an aging intervention. So the space is raw for kind of this more unconventional founder-led biotech model.
Mm-hmm. Mm-hmm. And, now thinking back to your own experiences with family offices, some of the learnings from the first fund, the longevity fund, and now obviously with your experience in raising money for age1, give us some learnings. I mean, obviously, a lot of companies out there that they may have go out and raise money for an age-focused biotech entity, and they can. They have to move their messaging around a bit too, right? Diseases of aging, or what have you. Talk about your time on the road, because now you're out there. You're not raising money for a company. You were raising money for a fund, high net worth individuals, family offices, institutions of various types. What was it like? I mean, how long did it take you to put together the 35 million? I mean, obviously, we can't say anything about who your limited partners are, but any fun facts, stories, anything about that particular aspect of the age1 experience so far?
Yeah, so in essence, it took us about 9 months to get from. So in essence, most of this year it was spent on the road doing exactly this fundraising process. Kind of biggest insights that I learned, I'd say one, this has definitely been one of the most challenging times ever to raise a fund. I'd say, we've had a very good experience in that we had a great track record between Laura and myself in terms of our personal investing histories. But just looking at a macro level, it's been a time when most of the LPs, the limited partners that you're going out there fundraising from, are very illiquid. Most of their money is still held up in these very, very illiquid investments on kind of the private equity side, whether that's unicorn companies that they haven't been able to experience an exit yet. And a lot of this is just a result of the fact that we've had a distinct kind of winter in the IPO kind of public offering market. And the cool part is that seems to be changing really rapidly right now. We've had a number of biotech companies IPO over the past 2 months, and it looks like a number of additional ones are lined up to over the next couple of months. So that may change. So lesson number one was just, it's very hard to raise in venture in times when the kind of exit windows are not around. So that was lesson number one. But I think that's not necessarily to say that it's a bad time to do it. I think you learn a lot in terms of raising when it's hard to raise. I think is actually a very, very valuable lesson as opposed to raising when it's super, super easy. I think you can. There are a lot of things that are good that actually come from having to raise in a difficult time. And I know Mark Andreessen, for example, has talked a lot about this, how Andreessen Horowitz raised their first fund back in 2009, kind of after the financial collapse then, and kind of all the value that they were able to attain because of that exact fact. So I think on the flip side, like the cool part is that valuations are much lower. The market is a lot more reasonable and kind of level set than it was, even just 2 years ago. So that was kind of just like one lesson about just like how to raise in a tough market. And I think like what you learn in doing that is that like a lot of funds will go to less conventional pools of capital. That wasn't necessarily a strategy that we took, but we definitely had a lot of peers in the space kind of shifting to more of that strategy. And I think the other thing that you kind of really learn is that relationships are the thing that matter the most. It's no different than any other facet of life. Fundraising ultimately comes down to building rock solid relationships. And the thing that you realize right away with LPs is that they are very, very interested in like multi-decade relationships. They are not in it for the short term. They're not thinking about short-term gains, at least in the context of venture capital and private equity. This to them is an extremely long-term game in terms of kind of meeting the needs and the goals of their organizations or institutions or family offices or wherever they're located. So I think that was another one of the key things you realize very quickly is that you're dealing with something that's a very, very long-term relationship, which is cool. Yeah, I think those were kind of the key things that I learned off the bat.
Excellent. So yeah, I mean, moving from raising, obviously you did it successfully, 9 months, and we have the new fund. Now you're going to be deploying it. I have full confidence that with your background, you're going to do fine at that. Talk a little bit about sort of the what I'll call sort of the strategic thinking in terms of managing these syndicates, because obviously you're, as I mentioned in the beginning, the fund is pre-seed, seed, and you're going to be going into these rounds with all sorts of other folks. And had my own experience there where, right, we all invested in a certain concept, and then in board meetings and so forth, things change, and the questions of developing a senolytic. Why are we doing it for osteoarthritis and not so and so? Why aren't we exploring consumer products? Why aren't we in the animal health business? And so forth and so on. Some of your experiences there. I mean, obviously it's early days for age1, but maybe in your previous work, any interesting stories, thinking, strategies in terms of managing a longevity investment syndicate?
Yeah, I mean, there's a lot of nuance here, as you're all too familiar with. It's one of these very rare industries where it's like, it's just so core deep tech, and I think it's actually been one of the coolest things to see, and that I think one of the reasons that founders want to work with us the most, one of like the biggest pulls that we have as a fund right now, is the fact that we are fully mission aligned and very, very long-termists in terms of how we think about the sector and how we think about portfolio companies. And I think for founders, this is like the most appealing thing, actually, because they are sitting there. They really want to spend their life making an impact to the aging field and delivering value in this space. And yet they know all too well that most investors just don't understand the field. They don't get it. They haven't they see it. They're interested. A lot of investors are interested in the space because the field has never gotten more interest than it's got today. But they're very wary, in essence, of new investors who are dipping in the space, of whether it's because it's a fad, it's the next big thing. Is it the next AI wave, the crypto wave, right? Or is it actually because of a long-term interest in the field that they're going to retain for a long time? I dealt with this actually just the other day with a company that had invested in one of the family offices, where another one of the investors, in essence, wanted to sell their stake in the company very, very early on, because in essence, the partnership wasn't very interested in this space anymore, right? And they were, but then decided that they weren't. And so it's kind of like, for a founder, that's one of the biggest risks that you could imagine, is in essence taking money and giving away ownership of your company to someone who doesn't actually support the long-term value and vision of what you're building. And I think that is terrifying, because ultimately you're going to one day get to the place where you've sold enough of your company, assuming you survive that long. You're going to sell enough of your company to which you're not actually still in the position of calling the shots fully. You're going to eventually sell a majority of your company, and then you're really reliant on kind of your cap table in terms of who still believes in the vision. You need to make sure that your cap table isn't full of people who are going to try to fire you, which is something that is not unheard of as happening previously. Going back to this, fire a less conventional founder and bring in somebody who's more of a repeat founder who has more experience doing commercialization. And I think in the aging field, it's just so key to do everything correct to set up a company to not face these horrible, decisions or kind of existential threat to long-term vision of what they're doing. This isn't to say that our portfolio companies aren't going to have to pivot many, many times on their journey to get to that long-term vision. Without a doubt, a lot of companies are going to have to be flexible in terms of what the near term looks like in order to get to that really long-term vision that we all are desperately craving. But I think having somebody else force you off that road, as opposed to a strategic short-term pivot that still falls under the bucket of that long-term vision, are very key differences. So in terms of how we think about syndicates, for us, it really comes down to people who we've worked really well with in the past, people that we trust are built into or kind of bought in, to the same long-term vision in terms of the ultimate value creation that will come by just sticking through and really getting to kind of the long-term outcomes in this field. I think a lot of it comes down to just connections of people that we've worked with in the past, that we kind of have a better sense that they really get the long-term vision. And luckily, on the family office side, we have a lot of connections that we really trust or kind of fit that category, because they really want to use the products themselves. Which I think is a cool aspect of investors or builders, is you really always want to seek out people who they want to use the technology themselves, and that'll help them stay committed for maybe a bit of a longer term mission than some other fields.
Refreshing to hear. Alex, talk a little bit, if you would, about the recent publication about in the middle, say August 21st, you put in the bioarchives, entitled "Longevity Bottlenecks," where you sort of really outline for whether it's funders, philanthropists, newcomers to the field, where the bottlenecks are, and what you would I think there's some nice keys here on what also you would like to see come to age1 for some of these solutions, specifically with regarding to improving biomarkers and interesting models, clinical models for studying aging. But say a few words about this particular paper, if you would.
Yeah, definitely. And this was, I should first clarify that this was not at all something that I played a very large part in. I played a very minuscule part in this work. It was led by a colleague, Michael Florea, who is someone who's been very passionate about making this project happen, which has been very cool to see. He's actually in the early stages of a stealth mode company in the longevity biotech space right now, which is super, super exciting. So he's a fun person to watch, in essence, the progress that he makes over the next couple of years. But in essence, he felt really passionate about making this bottlenecks analysis happen, releasing it to the public. The reason that I was a co-author and kind of a part of that work to some extent was just that I had done a similar analysis in a less public fashion. So back in my family office days, one of the first things that I did was kind of do alongside some very, very valuable advisors that we had at that family office, do kind of a landscape analysis of what bottlenecks exist to the field of aging, where in essence is our money best spent as a philanthropic organization to move the field forward the best that we can. And so in the process of doing that, learned an absolute ton about where we should be focusing our time and not focusing our time. Unfortunately, haven't published any of that yet, but it actually is in the works to come out in the next month or two, which we're very excited about. And so the project with Michael was in essence me helping to, in essence, test and see how the analysis that we did differed from the analysis that he did. But I think a couple of the cool insights from his analysis that I thought were really cool were kind of more focused on big data, really kind of honing in on the fact that in his survey, he really discovered that a lot of people in the field think that curated data sets that are, in essence, well done and unbiased is one of the biggest bottlenecks to moving the aging field forward. And I think what's interesting is I've heard of a lot of founders come to me recently and kind of have this vision of big data being the bottleneck to the aging field because they kind of sense this rise in machine learning and artificial intelligence and kind of the capabilities that we're seeing out of the sector. And they're quickly realizing that one of the bottlenecks to AI being able to make a bigger impact in the aging field is just the raw data that it would actually be able to need to deduce biological insight. And so I think that was one of the coolest bottlenecks and parts that an impact that really that new publication had on the way that I viewed the space.
Absolutely. Definitely. One other thing while we have Alex, can you say a couple words about the time initiative? Because I view this as sort of a piece in the apparatus to create the next 500,000 Alex Colvilles that are going to be coming down the pike and catalyzing this new generation. What's going on with that organization and your involvement?
Definitely. And so the immediate correction that I'll make is that we would be pretty doomed with 500,000 Alex Colvilles. But what we want is 500,000 extremely diverse younger generation members that have, very technical skill sets or are visionaries across a whole variety of different facets of engineering and math and physics and biology and politics and lobbying. There's just like so many different facets that need to be changed about the space. And I think in kind of that bottleneck analysis that I was working on at the family office, the first thing I realized was just that talent is the biggest bottleneck to the aging field. And I think this was like very not intuitive to me actually, in that I'd spent such a long time doing this Ph.D. studying the biology of aging, undergrad focused on engineering and biochemical engineering. And it was very hard for me to, accept the fact that it wasn't just solely technical progress that was the biggest bottleneck to the space. But really, when you look at it, like the number one thing that drives progress in a field, in a nascent field like aging, is the people. It's just like there were so many things that I wanted to do at this family office that I would look around and just say, we just don't have the personnel to go and carry out and like push forward this individual subsector field of the aging space. And that's really what led us to this conclusion of like, okay, talent is the biggest problem. And then it became kind of a thought exercise of like, well, why isn't there more talent in the aging field? Or how do we like diversify the skill sets, talents, backgrounds of individuals working in this field? And a part of the inspiration came from the fact that I realized, my own journey into the aging field. It took just coming across David Sinclair's work on the internet to, in essence, realize that the aging field existed. I mentioned earlier that ever since like 8 years old, I really like wanted to work on aging, and I just had no idea that the field even existed until, it was beyond halfway through undergrad for me, at the point of, I'd already chosen my major, I'd already chosen all this other research areas. And it's like, I just had no idea that the academic field existed. And so the Time Initiative, we really wanted to put it on the map for undergrads. We really wanted to put the aging field to the forefront of this field where there are kind of top minds as a society can go and work and make an impact, and really kind of flag for people what is possible if this field were to succeed. And so was extremely lucky to work with the American Federation for Aging Research on this project. And we very early on met Courtney Hudson-Pass, who is the program lead for the Time Initiative, who has just made she's just done tremendous job bringing that program 0 to 1 as its founder and program lead. She was a Ph.D. student in Jennifer Garrison's lab at the Buck Institute, who was just a rock star. And she was just very passionate about community building and really kind of diversifying the aging field. And so come full circle, we started working on this program probably about a year ago. And just now we were at the point of launching to announce all of the fellows which are in the program. So highly recommend that everybody go and check out the Time Initiative on social media to see, in essence, who these pioneering first batch of fellows are. There's some, a crazy mix of backgrounds from people who are obsessed with politics and have experience working with Congress already in undergrad, which is hard to believe, to people who are, working on very technical epigenetic editing parts of the aging field. Just a really, really diverse group of people. And when people are wondering what the kind of future of the aging field is going to look like, take a look at the kind of first batch of the Time Initiative fellows, and it'll give you a good sense of where the field will be going.
Outstanding. Mark. Ask one last thing while we have you. You mentioned at the beginning that you had just you came back from the longevity investors conference last week from Stad, announcing age1. Anything else coming up? I mean, obviously you're going to be busy investing now, but anything else coming up public facing we should know about in terms of other conferences, presentations, places that we can meet you, run into you? Anything else on the calendar as we get into 2024 that you want to mention? Please take the floor.
Great question, and excellent pronunciation of a town in Switzerland, which I will not even attempt to repeat. Notice I dodged that one.
I only know it from Dan Aykroyd and Trading Places, but that's all.
I love that. In terms of other things that people should have on their radar, I think December is going to be a huge month for the longevity field, which will be exciting to see. There's the Longevity Summit, which is being put on at the Buck Institute with Kristen Glorioso, who's the host of that one. There's the Bay Area Aging Meeting, which has long been one of my absolute favorite meetings in the aging field, which happens twice a year in the San Francisco Bay. So this is for people who will find themselves in California, but a really cool meeting of minds from UCSF, from UC Berkeley, from Stanford, from the Buck Institute, all coming together twice a year. Just a really, really magical conference. And I think beyond that, we will be hosting a lot of community events in the Bay Area and in Boston. And so we're co-hosting an event coming up in 3 weeks in San Francisco that I encourage people to reach out on our website if they're interested in coming to hang out in the Bay Area. We'd like to host kind of monthly events in San Francisco and Boston with grad students and founders in the aging field and investors and people from the tech space who may be interested in transitioning to computational biology or to working on longevity. These are all groups of people that we love to kind of bring together in interesting ways. Those are kind of the biggest things I have on my short-term radar for the rest of the year.
I'm sure it'll keep you very busy, but really, really great stuff, Alex. Big fan, rooting you and team on there with what you're doing. Again, for everybody that is going to be listening to this particular episode of our show across the podcast networks or watching on our YouTube channel, you've been spending time with Dr. Alex Colville, co-founder and general partner, age1, doing really amazing things to catalyze this next generation of founder-led longevity biotechnology. Alex, I want to thank you for taking the time out of his schedule to come talk to us, come educate us on everything you're up to. obviously, thank you for what you do for the longevity space. And as we like to say on our show, thanks for helping to create a better tomorrow via what you do. A really great story.
Likewise, thank you for all you're doing to do the same. And thanks so much for having me. This was really fun.
Great seeing you.